I'd love for you to come up and share a little bit about ABR's role with all of this.
Okay. I'm been brought up here to speak about the organization housed in this office complex, Advanced Bioscience Resources, and its role in the exploitation of Clementine. Through the staff of abortion facilities like the Cherry Hill Center in New Jersey, or with their own personnel, companies like Advanced Bioscience Resources target pregnant families before the scheduled abortions, promising them that their procedure will help medical researchers develop drugs that will save sick people. And make sure you heard me right. I didn't say after. I said before the scheduled abortion appointment.
Are you kind of a clinic worker as well with it? Do you help with the process, or you just wait?
No, we're usually standing right outside the door where they're doing the procedure in the OR, and we're in the lab area. And
okay.
That's
Gotcha.
And so we're just kind of standing around waiting, and then we get the tissue. The doctor makes sure that the termination is complete, and then we have it immediately after.
For some who are on the fence about going through with abortion, hearing all of this about medical research and helping, research diseases, create, therapies for people, therapeutics, hearing all of this can yank away the possibility for them to change their minds and choose life. That yanks away the chance for them to change their minds and leave the facility altogether. After the consent form is signed for collecting the aborted baby's remains, the child is killed, their life is ended, and then companies like ABR step in and ship the dead human remains off to medical research laboratories. In the year 2015, the news outlet Politico reported, quote, "The Food and Drug Administration has paid about $73,000 to ABR since 2009, federal health officials say, mostly for liver and thymus tissue that are used largely to develop a human-like immune system in mice that can be used to test new drug therapies without endangering people." Side note, how are they not endangering people? By crafting their study around population of human guinea pigs, around these aborted babies that they've decided to target from the outset. Back to the quote. "Advanced Bioscience Resources is the main paid provider of fetal tissue to the federal government," officials said. Close quote. That contract, by the way, with FDA laboratories was canceled in 2018, thankfully. It was canceled due to criminally suspect activity that the Department of Health and Human Services uncovered. You can learn all about that here. I actually have a QR code if you wanted to scan this now or later on. Yeah, anytime someone wants to learn more about ABR's criminally suspect behavior. The thing is though, even if ABR and companies like them cross all their T's legally, dot all their I's, what they're engaged in is exploiting parents. It is taking away a chance for parents to choose life. None of this should be allowed.
Yeah, but we also have clinics in San Diego, in Oregon, in Minnesota, and we soon will be starting in New Jersey and Philadelphia.
You do dissection to obtain the tissues that are on the list for the day?
We do dissection to get the tissues that the researchers have requested, yeah.
Staff waited until Clementine's mother was sent into the operating room, waited until she was rolled in a wheelchair, and was presented with this additional paperwork to sign. Clementine's mom felt that she couldn't say no. She's laying there under the influence of medication in this compromised state physically. No one explained anything to her, that she had a right to say no to the taking of her baby, or she was not in the right mindset to absorb any information given to her, for her to truly be able to give consent. But they got her signature. Today, Clementine's mom is fighting for her daughter's dignity. She's continually begging for her child's body. Clementine today can still be identified through medical record numbers. By law, this information is kept on file somewhere safe and secure for decades. So the two of them, Clementine and her mother, are inextricably linked in multiple ways. Two companies are mentioned by name in Clementine's mom's patient record information, ABR, and a company called Fetal Allocation Services, CERCLE, sounds like circle. From the public records, we know who the president of ABR is, an Alameda resident by the name of Linda Tracy. She's a public figure.
Ooh, Linda Tracy.
And she's been, noted in more than one article out there through the news about her work in this field. Turns out she is also the chief financial officer of this second company, Fetal Allocation Services. So we corroborated Tommy's research through our work at Pro-Life San Francisco and found that Linda Tracy's side hustle, Fetal, is listed as an East Coast corporation that just registered in California last year. And their listed purpose on the California Secretary of State website is Biotech Research Procurement Services, the same thing that ABR does. So we have an Alameda resident as an executive over both companies, both involved in the story of Clementine. We need to awaken the consciences of these people, of these executives, people who are our neighbors in the Bay Area community. They must decide in their hearts to stop targeting people and seek to help the world without treating anyone like research material, without considering babies in the womb as good as dead. Death is the villain here, and we cannot allow a system of death where killing is seen as a solution. It is not, it never is. It backfires, it creates disorder, and it's morally wrong.
Amen.
Let's call on Linda Tracy to do right by Clementine. Thank you.
Excellent, Robert. Thank you.